This is Dr.Aimee, and I'm here with Miss Janelle. Miss Janelle, go ahead and introduce yourself.
Hi, everyone. Hi, I'm Janelle Bartzatt, owner of GoldenHeartBirthing Services in Laguna Nigel.
Awesome, and we are broadcasting from Huntington Beach. We can allow some people to have a few minutes to catch on. But birth workers, this is where you need to be at, listening to Miss Janelle, who's going to give us a really good insight as what her services are for the beautiful OC, Orange County. So we're going to start off with, tell us about your business, Janelle. Or I should correct myself. Tell us about your service.
Yeah, thank you. Well, thanks, Amy. I really appreciate taking the time and chatting with you. It's always such a pleasure. So
absolutely.
So I'm a birth and bereavement doula. I'm also a childbirth educator for BirthWorks International. I am also mother of 3 amazing young gentlemen. And
3, yeah, that's right.
Yeah. Well, 4 if you call my husband. You count him.
There you go. One of them went to college, right? Already?
He's supposed to be, but
okay.
Right now he's trying to figure it out. So he's majoring in girlfriend right now, so that's okay.
Majoring in girlfriend, like that.
Yeah, exactly. So so that's what I do.
Awesome. Okay, so tell us what really got you into the services that you provide. You said birthing, you're a doula, and you said also bereave. I'm so sorry for mispronouncing on that.
That's okay.
Bereavement.
Yeah.
Yep. Sometimes my Spanish gets in the way, but
that's good. No, that's perfect. So you want me to tell you kind of what got me started?
Yeah, tell us your story. Why did you get into the type of services that you provide for the mamas in Orange County?
Okay. Well, kind of backstory. When we moved here shout out to Nebraska, we moved from Nebraska about 7 years ago. And so I had joined a MOPS group, which is Mothers of Preschoolers. And one of our presenters was a fellow mom, and she was a birth doula. And so she was telling her story of what a birth doula does. And as she continued to talk about providing support to moms and during their birth, I just was enamored. I was like, I want to do that. That sounds amazing. And that sounds exactly like what I want to do. I've always been drawn to mama's bellies and babies and pregnancy. And I just didn't know that was something I could do and, have fun and make a little income on the side. So that's how I kind of got started. And so that was back in 2010. And, you become a birth doula and you get into the mix and love and the energy that comes with being in that community. Right. And so we decided we needed to have a redemption baby in 2012. So
redemption baby, what does that mean?
That means that we had 2 babies in the hospital, and then we had a baby in a birth center. So I had a chance to, experience that and see what the difference was. And so we had an opportunity. We had a doula at that birth. We didn't have a doula at the other 2 births. And it was amazing. It was amazing. It was that additional help and that support was so beneficial. And
wow.
I, hope to give moms when I'm providing support is, just saving that space for mom and allowing her to do her thing. So I love it.
Yeah, I can tell by all your smiles that you're having. So was it a big difference, for you, at least in your own experience, from your first 2 kids to then your kids when you were supported? Well, with a doula?
Yeah. The difference was as far as having more education in my pocket. When we were first finding out we were pregnant, I was 21. So I just, you get pregnant, you go see an OBGYN. And so just kind of followed the system, and you just do, okay, you having a baby, here's how we manage your care. And with the second one, it got a little bit better. Had an amazing, both OBGYNs I had were amazing. But it just, when I became a doula, I was like, oh, you mean I have the option to say no thank you to an IV? Oh, you mean I have the option to move around?
Right. Yeah.
Really? I didn't know that I had that option. So getting more acclimated in the birth community gave me those, you know, that confidence of, oh, I could still have, you know, the options and be able to move around. So when we had our third son and had him at a birth center, it was like all my options, just the doors were wide open, and it was an amazing experience.
Yeah.
So yeah.
So it sounds like to me like you already answered like the next question I was going to ask you, and that was like, what do you love about your service? But did you want to add anything else? I mean, it just sounds amazing. Like right now, I mean, we're not pregnant yet, but I can see in the future how all of these amazing services like doula, midwifery, and is this correct? But I think I heard from a little birdie that you are going towards midwifery.
Yeah, I'm leaning towards that, you know, working at the birth center that I work at, has given me, an opportunity to see, you know, in the judges of the birth community and the birth work, and, seeing how amazing the midwives are that I work with. It just, it's empowering, and awesome. So that's kind of,
okay. Sorry if I caught you off guard with that question.
Yeah. No, that's perfect. That's perfect. So
I have to ask, like, tell me a story, like a satisfied from one of your satisfied clients, and how that came about.
That's an interesting question. I think for me personally, as far as I try to stay pretty humble. So having that testimony of like, you know, moms, you know, having a specific client testimony of success. I think for me, standing and I can't speak for all birth workers, but I think you get into this community and you love on each other. It's a sisterhood, it's a tribe. And so when I'm providing support for those mamas, I stand and I provide that space. It's saving that space for that mom so she can do what she needs to do and what her body needs to do, and just allow her body to open and surrender to that process. And you know, you and I were talking a little bit before this live broadcast, and I was saying that I don't know that any birth worker has really ever, you know, a birth doula has walked out of the birthing room and the parents have said, thank you. I get this every single time. Thank you so much. We could not have done this without you. And my response is always like, but you did. I just got to save that space for you. And I was honored to be able to, you know, just do a hip squeeze for you when you needed it. Or, you know, told your husband, go have a makeout session with you.
Awesome. I love that you promote that.
Absolutely. Because our favorite hormone in pregnancy and labor is oxytocin, right?
Right. Yes.
So what better way to encourage that than enjoy each other's company? So
most definitely.
So that's my testimony of client satisfaction. So
there you go. I think you mentioned that you wanted to show us a little bit and go in a little bit deeper as to what type of services that you have to provide. So by all means, please, let's hear it. Let's see what kind of services or like a little piece of education that you would like to share with our viewers today.
Sure. So I wanted to share a little tidbit of some optimal fetal positioning and optimal pelvic positioning that mamas can do to help get their hips in alignment and that pelvis in good position to get baby down, what we call that slippery little slide to come on out the birth canal. So so what I teach in BirthWorks is there's 4 optimal pelvic positionings. And so the first one is, I'm going to pull out my little baby way here. So this is designed similar to what your pelvis would be. So if you look at the similarity, so your pelvis is posterior and anterior, just like this. And this is the inlet and the outlet, if you guys can see that. So as moms are getting in a good position, so the first one would be uneven hips. How do we do uneven hips in labor? Mamas dance it away. You know, you've seen the other Facebook live feeds where moms are dancing in birth. Absolutely. That uneven hip of dancing is opening that pelvis even more. So marching, going up and down stairs, walking, that all provides that uneven hips, because when you do that uneven hips, you're opening that pelvis even more to give baby more room to get through. All right. So that's the first one. The second one is sacrum. The sacrum, your tailbone, is meant to move out as baby descends down past that sacrum, that tailbone. So a lot of times, you know, we say that the worst position to deliver is flat on your back. Well, the reason for that is because that sacrum is being pressed up against that bed. Right. So how is baby supposed to get past that sacrum if there's nothing that gives it that room to move down and past? So if you keep that sacrum out as opposed to tucked in, that can help babies come down that area even more.
That makes sense.
Yeah. So, you know, and if we look at the way we sit these days, our couches, our car seats, they encourage us to legs up, right? So that also forces that tailbone to go, you know, inside, tucked in. So that's the other thing that we have. So that's step 2. So we have uneven hips, sacrum out. The next one is hips, knees always lower than the hips. So if you look at
knees always lower than the hips.
Yep. Because if you look at, if you're sitting, again, here I am talking about that sitting position. When we're leaned back in that car seat, our knees are not open, right? So they're sitting there closing off. Sorry, I'm trying to put that down. So it's closing off that pelvis by sitting down. And then when you keep that open, the knees always lower than the hips. That's opening that pelvis. So I tell a lot of moms, I tell, you know, we talk about using the birthing ball. Well, use a birthing ball that is taller than you, because in normal, when you're exercising, you want your legs at that 90-degree angle when you're exercising. But in labor, that's not the case. We want mamas to have knees lower than the hips. Does that make sense?
Yeah, it does. I mean, in our office at, you know, Mama's Chiro, we always advocate, make sure that you get a ball. We call it that's going to be your next best friend. I even go and talk, I'm like, hey, let me introduce you to your next best friend. And they're like, what are you talking about? And then I show them, because in their office, we have like those big birthing balls. And so that makes total sense, especially, you know, coming as a birth worker, that you're strongly advocating that for sure.
Yeah. Well, and the amazing thing with birth balls too, no kidding, it's your best friend, because after you deliver your baby and your baby's a little fussy, you bounce on that ball, you hold that baby next to you, you're mimicking the bouncing in the womb, you're holding that baby next to you, they're hearing your heartbeat, they're listening to you. And if you're doing a quiet little shh, 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 that baby is going to go to sleep, because that's mimicking what's going on in the womb. So you're not kidding, it is.
Right. Did you hear that? If you have a fussy baby that's not crying, make sure that you're bouncing on your ball, especially if you were bouncing on your ball when baby was inside the womb. Now that they're earthside, if they're a little fussy and they just uncontrollable, no, I shouldn't say the word uncontrollable, but unconsolable, give them that familiar bounce on that ball. And then, as Miss Janelle has already explained, like it'll remind them of that motion of like when they were safely inside of you, Mama. So thanks for that tip. That was awesome. Now, I don't want to take too much of your time, but I do want to ask, do you have an offer for our audience at all?
Absolutely. If you're watching this Facebook feed and you're interested in taking a childbirth class, or if you're interested in doula services, if you book with me, doula services, I'll take $100 off my normal fee.
Whoa. Okay.
Yeah. And if I hope so. I want moms to feel comfortable and feel that having a support person can be very beneficial. So.
Most definitely. Well, that was our Facebook Live here with Miss Janelle Bartzatt, Golden Heart Birthing Services, and giving us some golden nuggets for our mothers and exactly what is it that her services are all about. So please check her out. Love and like and share this live broadcast. We will be doing some more with other birth professionals of both and I, Janelle, and I are very familiar with the other birth professionals that are coming on board and doing these broadcasts. And these are all for also our birth professionals out there in OC that want to connect with other birth professionals and really try to learn more about each other's services and how we can better connect and provide our wonderful services to our community, because really, like, this information needs to be out there and more mamas can be aware that they do have options, just as Ms. Janelle has already explained of how she came about to really coming into her passion, which is being a birth worker and providing these amazing services for all of our mamas in our community. So Janelle and I are part of an amazing group called Integrated Birth, and we do meet the first Monday of every month at 6 to 7:30. And this again is a shout out for all birth workers. If you want to connect, this will be a great opportunity for you. Ms. Janelle will be actually our guest speaker on this coming Monday, because it is the first Monday of the month. So if you guys are wondering how is it that you guys can connect more, please comment below, send us a shout out. You can go to Integrated Birth on Facebook, or you can definitely check out Ms. Janelle's website, and I will make sure to put it on this podcast and write in the comments. But it is Golden Heart Birthing Services on Facebook, and then you can also check out my site on Facebook at Mama's Chiro. That's MOMMASCHIRO, Mama's Chiro. So that was thank you so much for your time. I really do appreciate sharing about your wonderful services, and I hope you have a great weekend. Everyone, I hope you have an amazing weekend and enjoy the Super Bowl if you're into that.
Thank you, Amy. Appreciate it.
You're welcome. Absolutely. Have a great night.
All right. See you Monday.
See you Monday. Bye.
Bye.